OT Equator Biologic Attachment. Prosthetic Protocol. From surgery to the prosthesis. OT Equator Biologic is the first complete technique that guides the dentist and the dental technician from surgery to the final Toronto-type Seeger Bridge fixed prosthesis according to a strict protocol using precision mechanics components. OT Equator Biologic Attachment. Implant prosthesis rehabilitation. Before starting the surgical session, you need to have at hand the OT Equator attachments of suitable heights for surgery and compatible with the implants used. You can order the quantity of attachments needed by specifying every single height. However, in order to work in a better way, an autoclavable kit of 42 attachments of different heights from 0.5 to 7 mm is available. The dentist, after the insertion of the implant, can choose the attachment of the correct height to be screwed into the implant to maintain the sphere of the attachment at the gingival level once the soft tissues have completed healing. Surgical uncovering of the osteo-integrated implants. During the surgical uncovering of the implants, remove the healing screw. Apply the OT Equator attachment to the implant and tighten it firmly. Then unscrew it and screw it again. Repeat this procedure 2 or 3 times until you notice that the attachment is firmly fixed. Surgical and prosthetic protocol. Deferred loading prosthesis. Always screw the OT Equator biologic attachment into the implant during the first surgical session and never remove it again, both during an immediate loading surgery and during the uncovering of integrated implants. During the healing process following surgery, the soft tissues of the region will stick to the titanium attachment, creating a strong barrier against any type of bacteria. From this moment on, the implant will always remain under the gingiva. Protected by this barrier and by the head of the attachment. Characterized by a thread for the screw where it is engaged and locks the prosthesis. Prosthetic procedures. Clinic, laboratory, impressions. Following this protocol, all the prosthetic procedures start from the sphere of the OT Equator biologic attachment, characterized by a squared threaded hole that doesn't communicate with the internal surface of the implant. To work safely, you can connect all the transfers with a common dental floss and cover it with the self-curing resin to achieve a strong structure that will be included inside the impression and will avoid any errors. The use of the screwed titanium transfers requires an individual impression tray. This choice results in being more labor-intensive, but in many cases it is preferred due to the lower risk of errors. As an alternative, you can use the plastic strap transfers with a primary impression tray. To pour the model, first apply the metal analog inside the plastic transfer, then push it inside the impression where it will take its position. Maxillary arch, determination of the centric relation. Resin plaque with retentive caps and wax rim. In the laboratory, Build a plaque on the model using a self-curing resin and apply a wax rim with 2 or 3 retentive caps with their stainless steel container onto the plaque. Thanks to the caps, the plaque acquires the stability that allows the dentist to determine the mastication of the patient and to find the centrigulation with precision by letting them open and close their mouth. Maxillary arch. Analysis of divergent implants. Test resin plaque with extra-grade cylindrical abutments. In case of very divergent implants, in order to be sure that the prosthesis will be applicable, it's necessary to build a rigid resin plaque with extra-grade cylindrical abutments in order to test the fitting on the model and in the patient's mouth. Mount the extra-grade titanium abutments with the Seegers on the model with divergent OT equator analogues and apply the screws. The indented rim has to be directed towards the divergence of the implants. The indented rim is identified on the external surface of the abutment by a milled area. Apply some wax on the model and cover the edge of the abutment. Build a very rigid plaque using a self-curing resin. Polish the plaque. Removing it from the model and applying it again, you will notice 2 insertion lines that have to be followed in order to apply the plaque on the model. First on one side, then on the other. These insertion lines have to be referred to the dentist so that they will be able to apply the plaque in the patient's mouth in the same way before securing it with the screws. This test not only demonstrates that the prosthesis will be applicable, but also demonstrates the validity of the model. The same abutments used for this test plaque will be removed from it and applied to the final prosthesis, which in this case was built in zirconium. Mandibular arch. Determination of the centric relation. In the mandibular arch, the determination of the centric relation is also very easy. Thanks to the stability of the wax rim, you will not make any errors. Mandibular arch. Analysis of divergent implants. Inaccurate test plaque. The need to cut it and take a new impression was faced. If you notice some inaccuracies with the plaque in the patient's mouth during the test, cut the plaque into pieces with a burr. Put them in their correct position, secure them with the screws and some resin, then take a new impression. Dental laboratory. Mounting of teeth in the resin plaque. With the models mounted in the articulator, remove the wax rim and mount the teeth on the resin plaques by securing them with some wax. Carefully shape the dimensions and the aesthetics of the test prosthesis so that the patient will be able to evaluate it as if it were the final one. Mandibular arch. Test prosthesis in the patient's mouth. The test prosthesis with the teeth mounted in wax, stable and firm in the patient's mouth, allows them to evaluate the phonetics and the aesthetics. And to eventually give some suggestions. After this test, the dentist and the technician will be able to build the final prosthesis safely and without any errors. Prosthetic protocol. Conclusions. Always working on the head of the OT equator attachment in the patient's mouth and carefully following the prosthetic protocol. You can complete the rehabilitation of the patient in only 4 sessions of 15 to 20 minutes each, from surgery to the application of the final prosthesis without committing any errors. Compared to other techniques where every session requires the removal of the prosthetic connection from the implants and the careful mapping of the work time is considerably reduced. Moreover, following the OT equator protocol allows the dentist to guarantee the connection between the soft tissues and the titanium of the attachment, maintaining the biological barrier that protects the implants and the prosthesis from inflammation and peri-implantitis.